Say under these circumstances, it is safe to reopen schools so long as social distancing and other safety measures take place. But a lot of people are still wondering what will happen if a child or teacher gets COVID-19. And Kayla Green is live now to tell us some of the answers to that tonight. Kayla?
Maureen, Dr. Mendoza says as soon as there's a positive case in a school, the health department will begin investigating. They'll talk to anyone that they believe came in contact with that positive person and try to figure out where the infection came from. What happens next will depend on the results of that investigation. Dr. Michael Mendoza says if a positive COVID-19 case is found in a particular classroom, the health department will likely recommend closing that room for at least 24 hours.
It will give our team some time in the health department to undertake the contact tracing process to identify who in that class may need to be quarantined and who may not need to be quarantined and who might be safe to go back to school. And it will also allow us to understand if there was any further spread in that building. Because if so, we will want to extend the contact tracing.
Dr. Mendoza says someone who tests positive will be under isolation for 10 days. They'll be cleared to return to school once they're symptom-free for 3 days. They'll also be required to produce a negative test result and an evaluation from their doctor.
For people who are sent home for other reasons, it's a little bit more complicated, and we're in the process right now of ironing out all of those details. But suffice it to say, at the end of the day, we do not want to send anybody back to school who can pose a risk to any other students or teachers or to staff.
Another major factor when it comes to a positive case in a school, how many cases there are in the community. Dr. Mendoza says right now the prevalence is very low.
If that continues, we are going to have to see a very high prevalence in a particular school to want to close that school down. But if the community prevalence increases to the point that any number of infections in a school is enough to give us concern, then we might have a lower threshold for wanting to close an entire building down.
Dr. Mendoza says even though there's a higher infection rate in some zip codes as opposed to others, he doesn't think any district is more in danger than another. He says he's concerned about all districts, but is also confident in all their plans. Live in Rochester, Kayla Green, News 8.